I've often said here, COVID opened my eyes to the corruption of the medical system. Before the pandemic, I thought some doctors' organizations were acting like idiots whenever it came to the culture war, like gender ideology. But, on most other areas, they could by and large be trusted, right? I knew pharma was corrupt on the drug front, but my eyes were not open to the totality of corruption in the entire field. Doctors, both socially and financially, doing what's in their best interest, medical journals being used as tools of the establishment, abandoning real science, and most important of all, the pervasion of money into the very root of the system. Since then, my eyes are now open. My default position now for doctors is, when you make a recommendation to me, prove it. Why do I actually need something? Why is it not part of a larger money-making scheme? And it's with that orientation that I saw an interesting piece of news pop up yesterday from 5 years ago I never would have thought anything about. Quote, new draft recommendations by the U.S. Preventative Services Task Force that state that women who are between the ages of 40 and 74 should have screening mammograms every 2 years. The guidance is a big deal because previously biennial screening was not suggested for the age of 40, while those between the age of 40 and 50 were considered on a case-by-case basis. Now, according to them, because of increasing rates of breast cancer in the 40 to 50-year-old demographic, they're increasing screening recommendations for everyone. Pre-COVID, Saagar would have been like, okay, whatever, sounds reasonable on its face. Post-COVID, though, immediately I'm thinking this. Sounds like a multi-billion-dollar gift to the mammogram industry and the doctors and the nurses who perform these procedures. So, am I right? Let's think about it a little bit, shall we? It only took me like 10 minutes to find that not even 10 years ago, doctors involved with women's health were singing a very different tune about mammogram screening. In 2015, a major study in Health Affairs analyzed 700,000 women from 2011 to 2013 between the ages of 40 to 59 who had routine mammograms. 11% of these women had, quote, suspicious mammograms and were subjected to further testing, including repeat mammograms, ultrasounds, and needle biopsies. Quote, for nearly all these women, 98.6%, cancer was not confirmed in further testing. Now that's crazy, right? But it actually gets crazier. The study authors found that false alarms for women for the entire female population over 40 was costing the United States $2.8 billion each year on follow-up test results for suspicious results that were not cancer. And that's just the dollars. Over-treatment was actually even more of a concern. They said that even when cancer was detected, those tumors might be of low risk to the patient, but that once suspicions were raised, over-treatment was the result, including mastectomy, chemotherapy, radiation in women who may not have needed any medical treatment at all otherwise. A similar finding actually occurred in a major study of Danish and Norwegian women. Just last year, they found that, quote, the advantages of breast cancer screenings have steadily diminished to the point where they are no longer outweighed by the costs associated with overdiagnosis and overtreatment. The study reasoned that, quote, 1 in 5 women receive a superfluous diagnosis because of screening that they would never have noticed or felt that they had breast cancer during their entire lifetime, which leads to painful overtreatment and higher costs of tests. In fact, the Breast Cancer Action Network is a group based in the U.S., which is entirely premised on providing women with an average chance of breast cancer with facts like this. Consider this graphic that they actually produced. If a group of 1,000 50-year-old women is screened over the next 10 years, 100 will get a false positive, 23 will get breast cancer, 5 will die with or without screening, 1 will die without screening, but 5 will be diagnosed with cancer. That will never be life-threatening or require treatment, to be clear. The group and people who are raising awareness about this actually do care a lot, though, about preventing breast cancer. But instead, they want people to focus on what prevention will actually look like and stop it in the first place. That will be less toxic and more affordable both for them and for all of us. That's the final and most important point. The average cost of a mammogram in the United States is somewhere around $500. Now, considering the biennial recommendation, that's $250 a year for women from the age of 40 onwards. That is tens of billions of dollars a year paid in fat insurance premiums to the health insurance companies who give it away to the healthcare industry, and none of it makes the difference that they say that it will make. That's the issue with our medical system in a nutshell. We don't even focus on real prevention. Everything ranging from exercise, obesity, proper diet, a myriad of prevention techniques which other doctors like Dr. Vinay Prasad can tell you about. Reducing all-cause mortality on cancer specifically. And instead, though, we're spending billions on programs supposedly to help, but may do just as much harm instead. This is a common theme these days with so-called screening practices recommended by doctors. It reminds me of colonoscopies. That practice was recommended to millions of men now for years as massively effective. It didn't really work that well, though, at all when it had a gold standard trial. It only reduced their colon cancer risk by 1/5, way below the previous estimates of the test's efficacy, and, quote, didn't provide any significant reduction in colon cancer mortality. Modern medicine is premised on the idea that technology has conquered biology. It's what justifies their secret knowledge and their primacy in society. In some cases, that is true, but it's not always true. And this case highlights why all of the US and all of us must take back responsibility for our own health. Doctors and medical associations do not get to make decisions for us. We do. It is on everyone. Do research, ask questions, because if you don't, we are going to keep getting swindled in the name of keeping us all healthier. What did you make of this, Ryan? It's something that I'd never thought about.
Hey guys, ready or not, 2024 is fully upon us now, and Saagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.